Now, to the most important part of every show. Today's guest is Dr. Tracy Edwards, Medical Director of Sweet Comfort Hospice. Welcome, Doc.
Thank you so much for having me.
All right, there may be some people who are unfamiliar with what hospice is. Can you, if someone, and that may be a good thing because when you start learning about these things, you're like, oh, wow. What is hospice care?
So, there's some things in life we'd rather not have to know about.
Yep.
But, hospice is specialized medical care for those who have a life expectancy less than 6 months and who desire no additional hospitalizations or aggressive treatment. Hospice is for those who desire comfort when no cure is available.
Okay. I routinely have folks call me about different ideas for radio shows, and this one, when I heard about you and your organization, it kind of grabbed me. When I practiced law actively, I was on a bioethics committee for a hospice down in Florida, and the things that they would bring before our board every month, I just thought, good Lord, these people need be bathed in prayer because it was amazing the issues that come up in hospice care. As a lawyer, I was just like, oh, it was kind of rough. So I'm excited to have you.
Thank you.
Why would someone choose hospice care in general? Why not fight the good fight? Why choose hospice care?
Well, sometimes it's because there are no good medical treatments for the disease. And why do something medically that has only risk and no benefit? For others, they just don't like to be bothered. And it's a bother to go back and forth for medical treatments that may be uncomfortable. So rather than seeking a cure, a person might seek comfort and say, I just want to be at the house. That's my favorite place to be.
Right. Me and my dog.
There you go.
You see every so often someone who wants their dog, or I've seen horses too. I'm not a horse person, but people want to be around their horse as a life. Why does something? Why not take the risk? What is the mindset there with some people?
There's a lot that we can do in medicine that can feel like torture. There are things, procedures that can be done that are quite uncomfortable. And generally we do those things because we are hoping for a good outcome. We are hoping for improvement. But sadly, there are times when we reach the point that medicine just doesn't have improvement to offer.
Sure.
And it makes sense that we would offer comfort in that moment.
Okay. What kind of help, if you're to a point to where you're ready to make this decision, what kind of help is found in hospice care and hospice?
It includes an interdisciplinary team composed of a physician, nurses, a social worker, and a chaplain. They meet together routinely to discuss a person's health status and the social things that are happening in that situation, and they try to determine how best to help that person. They identify needs and try to address those in a way that provides comfort.
Sounds like it comes down to a decision. Do I want to continue going through this on the chance versus I'm comfortable. I'm at peace with myself. I'm going to choose the comfortable route.
Yeah, in particular, if you know that your life expectancy is short.
Right.
It just becomes, we all want to have a good day.
Sure. What kind of help is found in hospice?
Well, the federal regulations specify that each hospice must have a physician, a social worker, a nurse, a chaplain. And while those four are the required positions, often there are others included, CNAs, nurse practitioners. Each person on the team has a role to play in providing comfort to the one who needs hospice care. And Sweet Comfort focuses on easing pain, whether physical, emotional, or spiritual. That is our purpose.
So I wasn't aware of this. If someone's in hospice care, there's a physician involved, nurse or nurses, a social worker. Curious why a social worker?
There are times that additional help is needed. Sometimes there can be family conflict. A social worker may be able to help guide with that. Similarly, a chaplain may be needed in that moment as well. There are other situations, speaking of the social worker, I think of veterans. Many veterans were eligible for VA benefits, but never applied, never began receiving them. They just didn't need them. Well, then they reach a point of life where it's time for hospice. There are things going on. They could really use those VA benefits, but then they don't know how. It's been so many years, it's been decades since they were in the military.
Right.
And the social worker can help guide the conversation and get them in touch with the right person to get those benefits started.
I guess a lot of folks, when this comes about, it's not something a lot of people probably think through, plan. It's kind of like a will. Yeah, people fight getting a will in their lives because they're like, I don't want to think about my death. I guess this is people probably, and I use the word ignorant, not as dumb, but unknowing. People are probably pretty ignorant, unknowing of this process because it's not something we like to dwell on.
Right. And when I came into medicine back in the 90s, no one wanted to talk about code status and, full code versus do not resuscitate. But now I think enough of us have seen our loved ones sick that I find my patients readily want to talk about those things and be planning ahead while they're healthy, thinking, how do I want those emergencies handled?
Folks, today's guest is Dr. Tracy Edwards, Medical Director of Sweet Comfort Hospice. It is a tough subject, but it's one that in many ways we'll all face, whether personally or with a loved one. We'll be right back after these commercial messages. Thanks for tuning in. Welcome back, folks. Today we're tackling a tough issue for, I think, most individuals to give a little forethought to, especially with themselves and their family. Today, our guest is Dr. Tracy Edwards, Medical Director of Sweet Comfort Hospice. This was an important show to me because we all are going to face this.
Yeah.
But all right, how can hospice in general help a patient?
All right, so the staff are going to where the patient lives. They enter the patient's home, whether that's a house or a nursing home. And so part of it may be a CNA coming by and helping with a bath. And so when you think of the CNA helping with the bathing, not only is that a help to the patient, that's a help to the family. That's something they don't have to do in that moment. And then the nurses are going out. Well, nurses are invaluable. I mean, imagine watching your loved one struggle, you being in your own struggle, not understanding what is occurring medically, and really not knowing how to help. But then a nurse comes into your home, comes to where the need is, and helps. That brings comfort.
The big differentiator there to me is home versus hospital. I just had one of those every 5-year colonoscopies. There is nothing good about going. I don't want to offend anyone out there, and they were very good. Everybody, consummate professionals, great. I hate saying great experience getting a colonoscopy, but it was, as good as the circumstances would allow. But if you have a choice, you'd rather be at home, I think, for most things in life. So so with hospice care, you get to stay at your home.
Yes. And then, the family being there, it's the family that's there 24/7. It isn't hospice that's there 24/7.
Right.
Hospice
Sure.
just comes and does visits throughout the week. Well, sometimes family members need a break, time to rest, time to get away. And so hospice even provides respite through contract with a Medicare facility like a nursing home or a hospital. The patient can go in for respite for up to 5 days while the family goes and just breathes. It goes to a special event, whatever they need to do. And when they get back, patient goes back to the house.
Very
back
good.
to his home.
That'd be a big help.
Yes.
because the stress of it all. What uh, we've been talking about what hospice is. What isn't hospice? What would you say hospice is not?
Yeah, hospice is not killing patients. It is emotionally difficult when someone dies, and sometimes a loving, caring, grieving spouse might wonder, did I kill my spouse? Did the medicines I gave cause death to occur? But the reality is, everyone on hospice dies, even if they were not to receive any medications at all. They
Right.
are on hospice because they are dying. The medications are intended simply to help living be comfortable so that they do not suffer while they live.
Okay, so we're not talking euthanasia.
We are not, and certainly there's plenty of that talk to be had in America, but you would probably want to know that federal regulations specifically forbid that in hospice.
What else is not hospice?
Yeah, so hospice is not home health. Home health is for the one who has potential to regain strength and abilities. Home health is for someone who needs rehab so they can swallow better, get out of the chair more easily, safely walk to the next room, or learn how to dress themselves again after a stroke. Hospice is not home health. Hospice is for the one who isn't really expected to grow stronger. If I told you that you must exercise every day, get up out of that chair and do it, and yet you knew you were too tired to exercise, you were in too much pain to exercise, and I kept forcing you to exercise, after a while you would not like me very much. Well, home health focuses on exercise to improve the mobility, the swallowing, whatever the deficit is. Hospice is for the one who understands exercise won't fix this problem.
I imagine, well, let's not go there. Let me phrase it this way. What is the difference between hospice care and palliative care in general?
Yeah, years ago they meant the same thing, but words change definitions every once in a while. And so hospice now is for the one who has a life expectancy less than 6 months and says, I'm not going back to the ER, I'm not going back to the hospital, I want to be at the house. Whereas now palliative is for someone who has a serious illness, still has hope of a cure, hope of some treatment, but it's a significant illness. That person can get some benefits from a hospice company, which typically is a nurse practitioner going out about once a month, doing a home visit, just seeing how are you doing in your progress, anything we can help with along the way.
When did y'all open Sweet Comfort Hospice?
September 15th, just this month.
Oh,
Yeah, we're 2 weeks and a few days into it.
oh, wow! I did not know that. Well, good, good. I'm happy to participate this early on.
Yes.
This is awesome. Why did you open Sweet Comfort? What moved you?
Yeah, everybody needs sweet comfort. We all have difficult days in which we need to be comforted. We all need sweet comfort. Now, we don't all need hospice, but we all need sweet comfort. And when a difficult day turns into a difficult week and a difficult year, sometimes we need someone with special training, a team of someone's with special training to step in and make those days tolerable, to fill those intolerable days with sweet comfort.
And when you say team, we're referring to a physician, nurses, social worker, and
Chaplain, CNA, yep, all that.
Very good. Why is Sweet Comfort? I happen to see that it is a nonprofit. Why is Sweet Comfort Hospice a nonprofit?
It is a nonprofit. We've applied for 501c3 status. Being a nonprofit reflects the ministry mindset. Take care of patients, take care of staff. That's not a corporate mindset. No one gets threatened for not generating enough income for the investors. This
Okay.
is not that.
Okay, all right. Are you faith-based?
Yes, sir. And that's important. 1 Corinthians 10:31 says, whether therefore you eat or drink or whatsoever you do, do all to the glory of God. Everything the Christian does should be for God's glory. That includes going to work.
If someone is tuning in and they would like more information or God forbid, they're in this position, where could they learn more information, or how can they reach out to y'all?
We do have a website, sweetcomfort.org, sweetcomfort.org. And then our telephone number is 706-970-4560.
And that's sweetcomfort.org?
Yes, sir.
O-R-G?
Yes, sir.
Okay, sweetcomfort.org. Well, what about those who need hospice care but aren't affiliated with any specific faith, or could be agnostic, atheists?
Yeah. We will love on them just like we love on everybody else we provide care to. And, when you mention atheists, there are atheists who find themselves in a foxhole and they very much want God to be real. Those folks would love to have a conversation with the chaplain. And so we make that available to them. Now, the patients are not required to have the chaplain come out, but hospice is required to have a chaplain available for those who do desire it.
Is that a law or medical standard? What is that?
Hospice federal regulations. The chaplain is an integral part of that team, a required part.
Huh, that's kind of nice to know. Which geographical areas do y'all cover?
The short answer is anything within a 1-hour drive. So that's all or portions of towns, Union, Rabun, White, Fannin, Gilmer, Lumpkin, Habersham, Stevens, and Hall counties.
So y'all are able to get nurses out to those homes, social workers in that area.
Yes.
And folks, those areas again are?
Towns, Union, Rabun, White, Fannin, Gilmer, Lumpkin, Habersham, Stevens, and Hall counties.
And who pays for hospice?
Mostly it's Medicare. When you think of who is within 6 months of passing away, that's usually Medicare-aged folks, and so most of it's Medicare. But not everybody has insurance.
Right.
And so that's particularly where a nonprofit can step in. Nonprofits tend to be very giving, and we got Sweet Comfort.
Sweet Comfort Hospice. If you could sum up a mission statement or a vision, Packy just gave me the 1-minute finger.
Yeah.
What would you say your mission, or what's your vision in starting this organization? I mean, you're early on. What moved you?
We want to ease pain, whether that's physical pain, emotional pain, or spiritual pain. And so physical pain, everybody knows what that is. Emotional pain, I think everybody knows what that is. But spiritual pain, there are folks who ask, why did God do this to me?
Right.
Why am I sick? And they may not voice it, but it might be in their mind, and we can help.
Doc, thanks for coming. Folks, today's guest was Dr. Tracy Edwards, Medical Director of Sweet Comfort Hospice. I hope you'll reach out to them if you're in need. Thanks for tuning in. Look forward to next week with y'all.